Are you struggling with a loved one who is bedbound or homebound and can't get out? Are you finding it difficult to find good caregivers to take care of and manage your patient? Well, I can help you with that and guide you. I'm Bienstock, and I'm a board-certified plastic and reconstructive surgeon. I do house calls for wound care, meaning I take care of people who can't go to a doctor's office or a hospital or institution and need wound care in the home and don't have a physician. A lot of times wounds occur in the hospital or in the home, and this is usually due to the fact that a patient is not being turned. This all comes down to either a nurse or a caregiver. At home, the caregiver has to turn your loved one and change a position every 2 to 3 hours. Well, how do you know that the caregiver is doing this? This is something that I address and the families that I take care of address on a daily and weekly basis. You have to have a really good caregiver team, and this is really important to manage your loved one in the home. In terms of finding a good caregiver team, it takes usually a year to find a really good, solid team that you're comfortable with and that your loved one is comfortable with. How do you do this? Sometimes resources are an issue and you have to go through insurance. Other times you have to pay for it privately. Whether it's coming from insurance or you're paying for it privately, this is something you have to do as a family member, whether you're daughter, son, sister, uncle, brother, mother, or father, and have to screen the caregivers. And it's very difficult to determine what makes a good caregiver. This is something you have to ask your team, which will consist of physicians, nurses, but you also have to talk to the caregiver and make sure that they're following the caregiver plan, which means feeding your loved one in terms of nutrition, turning on a regular basis, addressing all medications that are going to be given. And this can be very difficult for you and your loved one. That's why you have to be present as a family member to help manage the caregivers. I have a patient that I saw last week who has a sister that's not present, and the caregivers who are very nice are not being managed, so they don't know how to take care of this patient correctly. As opposed to another patient who I saw right after that, where there's 3 family members, one is a daughter, one is a grandson, and the other is a niece, who are there 24/7 managing the caregivers, making sure everyone's following instructions. This can be very challenging, but the only way for your loved one to thrive at home and have a good quality of life is for you as a family member to really be involved with your mother, father, or uncle's care, and to be not on top of the caregiver, but managing them, being kind to them, being professional, and showing that you love your mother, father, or uncle, and then they will give you the same love back.